The last few years have been tough on students and their families. On top of the normal challenges that come with growing up, our students have faced unprecedented and ongoing stressors and challenges that have resulted in an increase in youth experiencing mental health challenges. It can be tough as a parent or guardian to know what is normal or expected behaviors, experiences, and emotions for the students in your life. In this video, we're going to review things to pay attention to with your own middle or high school students. The first thing to be on the lookout for are signs and symptoms that mental health challenges may be impacting your student. Some common signs that we'd want to take a closer look at include your student feeling sad or down or crying often, your student no longer finding joy in activities or hobbies that they used to enjoy, an increase in yelling, feeling angry, or aggressive behaviors, your student not wanting to spend time with friends or family, difficulty focusing, trouble paying attention, restlessness, hyperactivity, or the inability to stay on task, your student acting paranoid, suspicious, or out of touch with reality, a change in appearance such as not caring how they look, not taking care of themselves, and not taking care of their hygiene, worrying often or a lot, especially about things that are out of their control, a change in school performance like missing assignments, lower grades, skipping class, showing up late, or a refusal to attend school, feeling really tired or sleeping excessively at home or at school, a change in appetite or weight, hopelessness or statements that things are not ever going to get better, and finally, noticeable signs of self injury, such as deliberate cut marks or burns on their body. If you notice this last sign and symptom, please reach out for help immediately because we do not want to delay getting support if a student is engaging in self injury. If you notice that more than 2 or 3 of those things seem to be happening with your student, it's time to take a closer look. Next, if you answer yes to the following 3 questions, it may mean that your student could use some additional support. First, is what you are noticing a change from your student's normal personality or behavior? Next, have these signs and symptoms been occurring for more than 2 weeks? Everyone can have an off couple of days, but when we see these behaviors happening on an ongoing basis, we want to check in to see if more support is needed. And finally, are these things impacting your student at home, at school, or at extracurriculars? Some of us are prone to worry, but it does not impact how we are doing in other areas of our life. However, when it starts impacting us at school and home, extra support is key. Along with signs and symptoms that a student may be experiencing mental health concerns, there are some things that can put one at increased risk. Things like difficulty with peers and or making friends, conflict in the home or with the family, loss of a loved one, a history of abuse or traumatic experiences, low self-esteem, and exposure to violence can all impact a student's ability to cope with stressors. If you know your student has experienced any of these, take a closer look at the signs and symptoms we just discussed. Now that we've looked at signs and symptoms, how these can impact a student, and some additional risk factors, consider what you are noticing in your own student. Remember, if you're noticing a change in your student's behavior that lasts for more than 2 weeks and that is beginning to impact them at school and at home, reach out to your student's school counselor to talk about what supports are available to help your student. We are all here to work together to make sure that our students are as successful as possible. You know your child best, and you are incredibly important in supporting their mental and emotional well-being. Remember, mental health issues are common, and it is important to reach out anytime you have a concern.